Are you searching for your friend or a family member who has just been diagnosed with breast cancer? Or want to know more about breast cancer? Ever wondered what HER2 positive or triple negative breast cancer means? Or why do some only need surgery and hormone therapy while others require chemotherapy? Hello, my name is Shae. I'm a registered practical nurse, and today in this short video, I'm going to explain breast cancer, focusing on two subtypes: invasive ductal carcinoma, HER2 positive, and triple negative. Let me explain what breast cancer is. Breast cancer starts in the cells of the breast. Cells in the breast sometimes change or no longer grow or behave normally. These changes may lead to non-cancerous or benign breast conditions, such as irregular cell growth or cyst, or cells that start growing abnormally, forming a cancerous tumor that can grow or damage nearby tissue. Furthermore, it can spread to other parts of the body, a process known as metastasize. In this video, we're diving into a specific type of a breast cancer that originates in the cell lining the ducts, or so-called ductal carcinoma. These are the tubes that carry milk from the glands to the nipple. Now, ductal carcinoma can be in situ, meaning the cancer is still contained where it began and hasn't spread to nearby tissues. Or it can be invasive, which means it has spread beyond its original location into surrounding tissues, such as lymph nodes. Now that we know what breast cancer is and learned some fancy words, let's dive into more details about the two specific subtypes of breast cancer: HER2 positive and triple negative. After the biopsy of the suspicious tumor in the breast tissue, the hormone receptor test is done to identify the presence of estrogen receptors ER and progesterone receptors PR in the nucleus of the cancer cells. If these receptors are present, hormones can attach to the cells, influencing their normal behavior and growth, and cause abnormal growth. Therefore, the presence of hormone receptors in the breast cancer cells makes the results to be positive, while negative results indicate the absence or very few receptors on these cells. But there is another factor that plays a significant role in breast cancer. HER2 status testing is done on a biopsy sample taken from the tumor as well. HER2 is the more common name for the gene called ERBB2. HER2 stands for Human Epidermal Growth Factor Receptor. Normal cells have two copies of the HER2 genes. These genes control a protein production on the surface of the cells, which help them grow. Having too many copies of the gene is called amplification, which results into making too much HER2 protein on the surface of the cells. When the protein is overexpressed, tumor cells can grow and multiply too quickly. Hormone receptor tests and HER2 status tests are done on cancerous tumor cells to determine the treatment pathway. Now let's look back at our two breast cancer subtypes and break them down. Invasive ductal carcinoma HER2 positive means overexpression of the HER2 proteins on the lining of the ductal cells that invaded into surrounding tissue. And invasive ductal carcinoma triple negative, on the other hand, lacks the expression of hormone receptors as well as the HER2 proteins on the lining of the ductal cells that invaded into surrounding tissues. When faced with breast cancer diagnosis, it's natural to have questions and concerns. Your healthcare team will guide you through this process and tailor a treatment plan that is right for you. Your treatment plan will be unique to you, taking into account various factors such as the stage of the cancer, your menopause status, hormone and HER2 status, the risk of cancer recurrence, and your overall health. For hormone receptor positive breast cancers, which include tumors with ER positive and PR positive or both, hormone therapy can play a crucial role in slowing or stopping the growth of cancer cells. On the other hand, for hormone receptor negative breast cancer, which lacks estrogen and progesterone receptors, the treatment approach may involve targeted therapies, chemotherapy, surgery, and radiation. Chemotherapy, also known as systemic therapy, is often the primary treatment for stage 1A and 1B HER2 positive breast cancer and hormone receptor negative breast cancer. It targets cancer cells throughout the body. Targeted therapies like trastuzumab and pertuzumab Or the combination drug Phesgo may be used alongside chemotherapy for stage 1 and stage 2 HER2-positive and triple-negative breast cancer. Surgery such as lumpectomy or mastectomy may be considered to remove the breast tumor or the breast tissue, and radiation therapy, a localized treatment, is often offered after chemotherapy and surgery to further target any remaining cancer cells. A clinical trial is a carefully designed research study that involves human volunteers. Its purpose is to evaluate the safety and effectiveness of a new treatment or procedure. When you participate in a clinical trial, you become part of a closely monitored process, and if you are assigned to the treatment group, you will have access to the new therapy before it becomes available. However, it's important to remember that participating in a clinical trial comes with potential risks. That's why it's crucial to gather complete information about the trial and have a detailed discussion with your oncologist before making a decision. Clinical trials follow a series of phases from early small-scale to late-stage large-scale studies, and each phase has its own objectives and help researchers gather valuable data. For example, in Canada, there is a randomized phase 2 trial studying the effectiveness of carboplatin and paclitaxel with or without an immunotherapy agent before the surgery. This trial aims to treat patients with newly diagnosed stage 2 and 3 triple-negative breast cancer. Remember, clinical trials are an essential part of advancing medical knowledge and improving treatments. If you're considering participating in a clinical trial, make sure to have an open and detailed discussion with your healthcare provider. Together, you can make an informed decision about your healthcare. And I want you to remember that you are not alone in this journey.